I think it's really important for women to realize and to be aware that cardiovascular disease is the leading cause of death for women in this country. 400,000 deaths happen from cardiovascular causes, and to sort of put it in perspective, one woman dies every minute from cardiovascular disease, and when we compare it to common disease conditions like breast cancer, it's 400,000 against about 40,000 from breast cancer a year. So just to kind of give an idea of the scale of the magnitude of the problem. I think women also need to realize that they will present with cardiovascular disease about 10 years later than men do. 50% of the time women will not have classic symptoms of chest pain or chest pressure, and they will present with more vague and non-specific symptoms. It could just be a little bit of shortness of breath, some weakness, some fatigue that's out of the ordinary. It could be very non-specific, and the women who present with non-specific symptoms do worse when they get hospitalized for the same reason why their male peer got admitted with classic symptoms, because there's a delay in rendering appropriate treatment, because there's a delay in diagnosis. They have higher complication rates and higher mortality rates. What I tell my patients is anything that is out of the ordinary, that is not explained by anything else going on. Yeah, sure, if they're having cough and cold symptoms, they're feeling a little tired, that's fine. But if they're not having any other symptoms and they're having some fatigue that's unusual, that's preventing them from living their lives normally, they should discuss it with their doctors. Anything that's exertional, it could just be some mild shortness of breath that comes on every time when they walk around the block. That's what I want to hear about. We do a lot of this in our office visits. So when somebody comes to the office, in addition to discussing symptoms, one of the key things that we do is calculate risk. It's a risk calculation, and these risk calculators are derived from population studies, where it sort of stratifies patients into low, intermediate, and high risk. And then we individualize that risk based on the patient's specific factors and make recommendations, management recommendations. And you know, the cornerstone of risk reduction is really controlling cardiovascular risk factors. The traditional risk factors being hypertension, diabetes, dyslipidemia, and then there are others like physical inactivity, diet, you know, family history. Really controlling all these risk factors and reducing risk so they don't deal with those complications.